I'm Amy from Helping Hands Home Health in Pocatello, Idaho, and today we are going to talk about transfers. A lot of patients that we see, we have to get them out of bed, and so I want to make sure that you are trained to get a person out of bed properly so that you're not hurting yourself or the patient or a family member, whoever you're taking care of. So first thing that I want to make sure everybody knows is have the person do as much for themselves as possible. Number one rule of a therapist. Yes, CNAs, they'll do everything for them, but therapists, you want the patient to do as much for themselves as possible or they will not gain any strength back. So first things first, I want to ask her if she can get herself to the edge of the bed. Can you get yourself to the edge of the bed?
I think so.
Perfect. Then what she's doing is called a log roll. So she's rolling herself to her side, bringing her legs over the edge, and she's going to push herself up using both hands, coming up to a seated position, okay? Now, if a person cannot do that on their own, you can help, but you want to make sure that you, especially since this bed is really low, you want to make sure that you are protecting your back by using your legs, squatting down, and don't ever just bend over like this. You will kill yourself. Doesn't matter if you're 18 years old, when you get to 38, you'll be wishing you didn't do that. Okay, again, we're going to go get the gait belt back on. You want to have the teeth first, just like we talked about in our last video. Coming around, and you want to get it as tight as you can. Be careful if there's any kind of tubing come out of their stomach or side or anywhere on their body. You got to be careful with that. Okay, getting that as snug as they can handle without hurting them. You want to make sure that the person is scooted out toward the edge of the bed. That is going to help you and help them use more body mechanics. And if you notice, she kind of scooted side to side. If they're not able to stand to scoot forward just like you and I would normally do, like that, have them do a scoot. So it's like they're, well, how would you call that? Like a scissoring. One side forward, then the other side forward. Okay, another thing that you want to know is do not ever, ever, ever let a patient grab you around the neck to stand up. You're going to hurt yourself. Okay, so the best thing that you could do with the patient is teach them to push themselves up. So hands on the bed, and they can use their arms to push themselves up. That is going to be the best thing for you and the patient. Okay. Again, you want to use your legs to stand people up. Do not just bend over back at the hips. It will hurt your back, I promise you. Experience. Okay, so I'm coming down in a good squat. I want them to lean forward, nose over toes, and help me pull them up. And again, you're using your hands underneath the gait belt to pull them forward. And when they're up, depending on their stability, you want to make sure that you have a nice stance. And keep hold of them. If they need that extra stability, I'm able to just keep her intact here. Okay? Okay. We talked about the basics of standing straight up, talked about standing to a walker, and now we're going to talk about transferring to a chair or a wheelchair next to the bed. Sometimes that's just easier for patients or family members to be wheeled around the house, whether they can't walk or not. Okay, so depending on what their abilities are, you might need to transfer them to the wheelchair. So we're going to show you the basics of just doing a stand pivot transfer. So the first thing is you want to have them close. So I'm going to have her scoot over, using her arms, pushing herself up and scooting herself over to the chair so that you're not having to stand up and try to have them sit farther away. You want to be as safe as possible with all of these transfers. Again, since it's a low surface, I'm going to get a wide base of support and use my legs to help her stand up. Again, never have them grab around your neck. It will hurt you in the long run. It's not safe for your back or your neck. We're going to come down here. I'm going to come underneath to pull forward. Again, I'm going to have her bring her weight forward, nose over toes, forward and up. Take a step over. Reach back for the chair, nice and controlled, going down, again, using my knees. Sometimes when they do a transfer, if they don't feel comfortable not holding on to anything, sometimes I have patients either hold on to my elbows or reach for the chair, just because depending on their abilities or their fear of falling, you want to make them feel as comfortable as possible, but you want to keep yourself safe. Let's try going back to the bed. So we're going to push off from the chair. What's that?
I'll hold your elbows this time.
Okay, so I'm going to have her push off from the chair to begin with, and then once we're up, she'll hold on to my elbows while we do a stand pivot and sit down. So here we go. We're going to come nose over toes, hold on to my elbows, couple steps, reach back for the bed, coming down. You want to lower yourself down with them so that you're not letting them fall and bending from the hips as well. If the patient is not able to take a couple steps, whether they're not able to bear weight or whether they're not able to weight shift back and forth, you want to position them in a way that allows them to pivot easier. And one way to do that is obviously having them close to the chair, bringing their leading leg forward so that as they stand up, it's easier to get them to turn. So here we are. Another way too, sometimes patients can use the chair, since it's a little higher, the armrest, allow them to push themselves up more. So let's try it in this position. Leg forward like so. We're going to come up and down. Thanks for watching our YouTube video on how to perform a transfer. I am Amy.
And I'm Christy.
We are from Helping Hands Home Health of Pocatello, Idaho. Bye.